would like to introduce David Nolan. We were talking last night. We decided that we are so old that we can't even remember how we first met. So David has phenomenal experience. Last night we all kind of entertained each other with decades of stories, but he has phenomenal experience. He is with OnLok, which is a PACE program, but he has done research, he's done, been all over the country. He was sharing last night how he's worked in rural communities, and he is just passionate. But really, the other part is he is a how can we figure this out and make this happen individual. And I have just the utmost respect for him, and I invite him to share his experience in OnLok.
So it's so interesting when you do a set of PowerPoint slides a week or so ahead of time, and then you get to where you're going to be doing it and you're writing notes frantically wanting to change your slides. I'd like to do a couple things. I'd like to, when everybody leaves, I'd like them to understand what PACE is, really, really what PACE is. And I come from OnLok, we're sort of the mothership of PACE, but I think that's important. I'd like you to understand the relationship we have with the Sisters of the Holy Family and with the Dominican Sisters of Mission San Jose, because it's just a wonderful, wonderful relationship. And hopefully there are other PACE sites, obviously, across the country. Who said Cadillac Care? That so struck me, because what I wanted to say was every single person should have Cadillac Care. Every sister, every human being should have Cadillac Care, and there shouldn't be this this sort of bifurcation of care like that. So, wait, don't do it yet. So you know how when someone introduces you, they say who you are, and they give you kind of a really warm welcome, and they establish your credibility. So I would like to establish my credibility in a slightly different way. Yes, that's me. I was raised by an incredibly wonderful grandfather who came from Ireland. And to say my grandfather was Irish Catholic was, my grandfather went to church every single day. He went to Mass every single day. He believed, I think he'd be rolling over in his grave a little bit right now, but he just really believed in his religion. I come from a big Catholic family, so one boy was a priest, one boy was a nun, one girl was a nun. I know I come from San Francisco, but so one of the great treasures of my life, when my grandfather would be out with us and he would point to me and say, "This is my grandson, David, who's going to be a priest." So I entered the minor seminary, and this is after I graduated from the seminary, you go to the novitiate for a year and you spend a year in prayer and try to decide whether you're going to take vows or not. My grandfather passed away right at that time, and what I sort of realized then was I really didn't have a vocation as much as I had a desire to please him. So I left and did many other things, so that's my street cred. So how many people know PACE? How many people know OnLok? Great. So the easiest way for me to describe OnLok and what we do is we believe that people should be able to age in the place where they want to age. And 99% of people want to do that in their home. So our entire job is to keep people in their homes and out of nursing homes. We started in San Francisco's Chinatown mostly because the population there wound up going to nursing homes, and nursing homes where people only spoke English. and there was no Chinese food, there was no Chinese culture. So our program was really built around a small group of Chinese Americans and Italian Americans. It was in the Chinatown North Beach area. This is my second iteration at OnLok. I was there in 1987 to 1993. And then I left there and went and did a whole bunch of things in healthcare. OnLok has always had a really great place in my heart for a couple of reasons. One is I met my wife there. She was the director of nursing. And I always like to say that she taught me healthcare. I thought I knew healthcare, but she, you know, when you're a nurse and you're doing daily care of people, you really get a very different impression of it. So from that single site in Chinatown, there are now 130 PACE sites across the country in 30 states. We serve 47,000 people, which is very frustrating to me. We should serve 147,000 or 247,000 people, but the program has grown slowly. We do have an initiative right now to bring another 100,000 people into PACE over the next year. So we'll see how that goes. So how do we do what we do? We essentially surround every single person with a care team. And when I say a care team, we have all of our own staff. We don't contract out. We contract out to some specialists, cardiologists, and other people like that. But doctors, nurses, PTs, OTs, social workers, dietitians, recreation therapists, caregivers, everybody works for us. We serve 1,500 people, and my staff right now is closing in on 900. So you can kind of see it's a pretty high-touch organization. People come into PACE or OnLok, and essentially they have to be nursing home eligible. But we determine with them, we are very person-centered care, what their care plan will be over time. And it's done by a group of about 11 different people. One of the tenets of what we do is that every person on the care team is as important as every other person. Now, those of you, there aren't any doctors in the room, are there? Okay, good. Doctors don't get that. Our driver, I think, is almost important, or is as important as the doctor. Because our driver sees that person every single morning. They're almost the first person there, and they're the last person that sees them at night. So the care team's a really valuable thing for us, and you can see who's on the care team. We don't talk about money. One of the things I always tell my team is that money is not something we worry about. They worry about it. I have to worry about it. But we don't care about money when it comes to care. In other words, we provide the kind of care that if it's 24 hours, we provide it for 24 hours. Whatever is needed, we do, because it is our responsibility, and I'll go back again, to provide Cadillac care to each and every person. So I should probably talk a little bit about money. Nobody pays anything to us. Let me rephrase that. Anybody who's in our program does not pay anything. Every single thing that people receive in our program is funded through Medicare and Medicaid. So the beauty of a capitation funding is we get to spend the money in the way we think makes the most sense. And obviously we spend it on doctors and nurses and hospital and things like that. But the flexibility comes when somebody needs something very different. The other day, someone came in and said, we have a person with bed bugs in their apartment. What are we going to do about it? I said, great, let's move them into respite for 3 or 4 days. We'll de-bed bug their apartment. Now, you're never going to get Medicaid, traditional Medicaid, to debug somebody's apartment. We have helped people with their animals. We've put an air conditioner into a person's home. We've done all kinds of different things that are not necessarily about quality of care, but are really about quality of life. Let me just kind of describe a day in the life of somebody who's with OnLok. So you're living by yourself. You probably live in somewhere in San Francisco or one of the other areas where we serve. You might live in what's called a single room occupancy unit. So a caregiver is going to show up early in the morning, help you get dressed, help you make a little meal, get ready for the driver to come. Driver will come and pick you up. The driver comes into your apartment. This is not a curb-to-curb service. The driver will help you downstairs or carry you downstairs. A lot of the places where our people live, they don't have elevators, so we have two-person carries downstairs. They get you in the van, bring you over to the center. We have 7 centers serving 1,500 people. We have a lot of our own housing as well. But when people come in the center, any number of things can happen. They're going to get PT, OT. They may be seeing the doctor that day.
Quick question, when you say there are 7 centers, do you mean here in Pennsylvania?
Oh, I'm sorry. Yeah, I've never said where. I'm from California. We have 7 centers in San Francisco, Alameda County, and Santa Clara County. So, but I'm actually going to ask Sister Mary Kay in a little while just to say a little bit about what's going on in Pennsylvania as well. Not so good. So when you come to the center, you may see the doctor, you may see the nurse. Depending on what your needs are, you may have to get triaged for whatever. You may be going out to a specialist. We drive the person there. I always used to think when I first started working for OnLok that it was the medical piece of it that was really so important, because you're trying to deal with people with very chronic health conditions. It really isn't. It really is, to me, the socialization, that people coming in and seeing other people and making friends and things like that. Everybody's nursing home eligible. Everybody's over 55. They all live in the area that we serve. But in the end, it's really about how they interact with everybody else and the socialization that they get. When people come into the program, the first couple weeks are really, really important to us, because it's when people start to create relationships. And we lose them if they don't do that. So the quality of the care that we provide is back to, again, Cadillac care, but I think what's most important is the quality of what happens in the center every day. At the end of the day, the driver comes, gets the person back in the van, takes them home, takes them back upstairs. The caregiver is usually there to meet them, to make sure the person gets in bed and has a meal. We often will send a meal home, or obviously when they're in the center, they'll have a meal as well. Let me drop to the bottom. This is one we fight about all the time. I think we should take everybody. Now, my team does not agree with me. And obviously, I'm not the care provider, so it's a little easier for them. But it's really challenging. We have people who not only have incredible chronic health conditions, but have significant behavioral health problems. They have significant drug or alcohol problems. And so we have to deem them safe in the community. So the chief medical officer and myself, whenever there's a challenge around that, have to make a determination and have to come to some agreement whether we can bring someone into the program who essentially may not be safe living in the community. Now, the problem that I always have with that is they're living in the community. We can impact their quality of life somewhat. They're going to wind up in a nursing home if we don't do something. So it's always a big challenge, and we do not always agree. So we were approached by 2 orders, the Sisters of the Holy Family and the Dominican Sisters of Mission San Jose, to provide services to them in an area that we hadn't served before. and we had never served religious communities before. It's hard not to appreciate how wonderful these two groups are. When your mission is to seek out and advocate for the poor and needy, especially families, you just want to do the right thing for a group like that. This is an order that has a defined number of sisters right now who are all, well, I want to say they're aging, most of them are aged, and they have no new postulants coming in. They are incredibly land rich. They own a piece of property in Fremont, California, that is stunning. They are not cash rich. So their concern was, everybody's shaking their heads like, been there. They were really smart. What they did is they looked at their property. It was costing about $250,000 a year to maintain their property. And they decided that they could divide it into 3 pieces. They could build one piece with $1 million homes to sell to people who could afford $1 million homes. There is a very, very stunning piece of their property that really needs to be kept as sort of open space. So they defined that. And then they took the 3rd piece of their property and they built cottages for themselves. So when I think Robin mentioned mother houses, they had 2 beautiful mother houses on the property, but actually sold those as part of it and used the money to build the cottages. Now, all of their health care is free. All of their health care comes from, for the sisters who are eligible, comes from the PACE program. So right across the street, which seems so strange to me, are the Dominican sisters. And their mission is to stand in solidarity with the young, poor, and vulnerable. So I always think that because people are sisters that they kind of know each other and hang out with each other. But they hadn't ever walked across the street, I guess. It's a busy street, so I understand that. So the Dominican sisters came across the street one day and met with the Sisters of the Holy Family and said, you know, we have a mutual problem. Now, their congregation is a little different. They have new postulants coming in, but they're the same problem that the Sisters of the Holy Family have. They have an aging group as well, and they decided they would sit down and try to figure out how they could work together. They brought all kinds of groups in to talk to them, groups that are going to solve their problem, going to build things for them, going to make it all right. And OnLok was one of the groups that they brought in. And so they determined that OnLok was probably the best option for them. I wrote up here Sister Sharon. Sister Sharon was the leader of the Sisters of the Holy Family at that time, and Sister Rose Marie, did you know her? Was the head of the Dominicans. So when you talk about how you solve problems, I don't want to say it begins with great leadership, but these 2 sisters were incredible. I'm going to talk about the process that we went through. It wasn't an easy process, but every time we ran into roadblocks, between our flexibility and their flexibility, we made it work. So it was decided that we would provide services to them. And let me tell you how challenging that is. It was a new area for us, so we had no buildings, we had no staff, and normally when we go into a new area, we're hoping that we're going to serve 100 to 150 people, just because in the end of the day, I have to make the money work somehow. We were going to start out with serving 8 sisters. And it was a leap of faith on our part to say that let's start serving the 8 sisters and let's see how that will work. The beauty of it is the Sisters of the Holy Family had space on their campus for us to actually open a center. And the center existed there for was opened in 2002, so probably for about 14 years, and we use that center continually. We still serve 40 sisters. We don't serve them the same way anymore because they got rid of the site that we used to serve them, but we built a site then. We decided that we would be in Fremont, and the sisters asked us to wait for 2 years to bring other people in. And that was a little bit of a challenge as well, because it was going to be a rocky 2 years for us just financially. But we waited for 2 years because they really wanted to get used to the idea of bringing other people that were not part of their community, but actually are part of their larger community, I would guess, onto their campus in a ways that they really hadn't before. So what were the challenges? The first challenge for us was those 2 years were rough. And we were very, very flexible, because when you're serving 8 people and you're doing meals, imagine you're serving 8 people and you have to have a full complement of staff. You have to have doctors, nurses, PTs, OTs. And Fremont's right, it's the Bay Area, but it's an hour to an hour and a half to San Francisco. So you're moving people back and forth. So it was a challenging time. The other thing that I can't impress enough how challenging it is for change management. We had to change. The Sisters of the Holy Family had to change. The Dominican sisters had to change. And you know, there's this thing where you think the sisters are the sisters. They're not. I should tell you that. We were surprised. We really had to understand their culture. We were used to dealing with a group of community people in very different ways, and the sisters had a culture that we had to adapt to. One of the scary things, they had their own staff that were taking care of them, and one of the scary things for their staff was, are you going to fire us all? And we were so happy to say, no, we're going to hire you all. And that was a really important thing, because these are people who are providing personal care to the sisters, and they were comfortable with that group of people. We were comfortable with that group of people, so it really was a nice transition there. Our program is built around bringing people into an adult day healthcare center, where they, obviously come for the day. We had some challenges there. Now, the Sisters of the Holy Family are on their own campus, and so they're like, well, do we really have to walk down into the thing? Can't you just come and where we're living and deliver services to us? As opposed to the Dominican sisters, because we pulled a bus up to their thing, and it was a party every day. We're getting on the bus and we're going across the street, and so it was a really weird dynamic to be between the two groups of sisters. One of the things that was a challenge then and continues to be a challenge, we have our own physicians, and the one group of the sisters said, one of our criteria is you have to take our physician, and we want to continue to see our physician. We don't normally do that for a lot of reasons, but we did that, and it has been a little bit challenging. Our physicians work in a very, we see people a lot. We may see somebody 3 times, a physician may see someone 3 times a week, and a normal doctor does not see someone 3 times a week. So that has been a bit of a challenge. So bringing community onto the campus. So we waited 2 years, and then we opened it up. And the sisters loved it. It was all these new people and these new relationships, and it was like this vibrancy all of a sudden, having different people there on the site. So while they were very trepidatious about it in the beginning, they really liked it as we got closer to doing it. So the consolidation happened in 2017, and when the consolidation was selling off parts of the property, we were no longer going to be there. And in the space of a single day, we had to transition everything to our new center. Now our center was open and running, but I really have to give our staff kudos that when we made that transition, it was really challenging. The other is that one of the challenges was the sisters had created these new houses. There were like, I think there's like 8 of them or something. So now we go from serving people in a sort of a congregate setting in this mother house, which was really, really easy, very efficient, to now we had like all these different houses we had to serve people in. So when I say that people have to adapt, I'm always really careful. We don't tell people that they have to adapt to us. We have to sit down with them and decide maybe it's us adapting to them. And while it was much less efficient to deal with the houses, it's actually worked out fine. We provide 24/7 care into those houses to this day. And it's interesting because it's rare for us to do 24/7 services into people's homes. Partly because it's just, first of all, having our staff out on the street in the middle of the night and early in the morning, and there is a cost issue with it. There's all kinds of issues with that, but because the sisters had this congregate setting, it made it that much easier for us. So, perspective. This worked partly because of great leadership. You know, I worked with Sister Gladys, who followed Sister Sharon, and I just think that the leadership, at least at the Sisters of the Holy Family, was incredible, and the same with the Dominican sisters. If you ask anybody on our staff, they would tell you that it is a gift to serve the sisters. This is a group of people who have spent their lives serving other people, and now we have the opportunity to not only serve them, but to provide Cadillac care to them. So there is not a person on our staff who would say anything other than what an incredible gift it has been for that. And we would love to expand. We would love to expand to serve the Sisters of Mercy, for example, just below San Francisco, and some others as well, because we think it is, we just think it's a wonderful group. So I always think back to my grandfather, and I always think that he would be proud of the work that we were doing with the religious communities. I have to give a sort of a shout out to the Sisters of the Holy Family, the change they've gone through over the last few years, with not only with OnLok, but with their campus being divided up and moving and giving up so many traditions and so much change was just pretty incredible. People have come from all over the country to the Fremont campus to understand how it worked, and so that continues to happen. I was going to talk about the streets of San Francisco and try to draw some analogy. I walk home every day through what's called the Tenderloin in San Francisco, which is the just horrible open-air drug market, just people with incredible behavioral health challenges, and you know, there are people we should be taking care of, but I often think of the simplicity or how easy it is to care for people in community, how challenging it is to care for the people who live on the streets in our own community. I kind of have to laugh. Every morning when I get up, I go in and take a shower, and then I come out and I go like this, and I wipe the mirror before I start to shave. And as soon as I look in there, I'm always like, who the hell is that? And how did he get this old? So I want to finish by reading you something I got in the middle of the night last night, if I can read it. This letter came to us, and someone sent it off to me last night, and it says, "Dear OnLok family, with a heavy heart we wrote this letter because our father Chung Lang Mai has just passed away. We are also very grateful that we have this opportunity to express our sincere thanks to the whole OnLok family. My mom spent her last 4 years at OnLok, and my dad spent 8 years there. Together, it's 12 years of dedication and care. We couldn't imagine how we could have coped without you. We have 3 siblings here to share the responsibility for our parents' care, but all of us have our own family and career. So we couldn't do this all by ourselves without major sacrifice. It is miraculous that we found you. You have been more than a helping hand. You also provided guidance and mentors in terms of our parents' care. We couldn't thank you enough in that our parents received the best care, I'll put in parentheses Cadillac, they could get and lived to longevity, and we the children maintained the normalcy in life and kept our sanity. We hope we could thank you all individually, the clinic, the social workers, the home care, the PTs and OTs, the dietitians, the drivers. It's impossible to list them all, but we do want to bring up a few individuals who played a critical role in our father's final moments. Wendy was caring for my father when he turned from OnLok on his last day, and from her usual attentiveness, she noticed that he wasn't like his usual self. She alerted home care nurse Mary and our family so we could gather around our father to accompany him on his final journey. Wendy stayed way beyond her shift to help out until our father's passing. Mary authorized Wendy's stay and was quick to summon the nurse, Yan, who showed up promptly and administered professional care to our father. Our father's final moments were peaceful and painless thanks to these great people, and we couldn't thank them enough. We want to repeat an old Chinese saying that the paper is too short to contain all the thanks. That's exactly how we feel right now. Hope you keep up your great work to benefit the elderly and their family to make dignifying golden years possible. So I work a long days. We all do. And this makes long days worthwhile. So let me stop there and just ask any questions. And Sister Mary Kay, you want to? I know you've struggled with the PACE site that you are currently working with.
I think what was important, what you had said, is that you make it work. I think with our provider, that's not always the first line of business. We have a provider in our building that rents space with us. Right now we have 20 sisters enrolled. We had 30 previously. And we continue each day to struggle with the relationship between the congregation and the provider. And it's not always we've tried to sit down with them together and work out some of the things, but it seems like it's not what your approach has been. Ours is a little bit different. And we continue to work on that to see how we can provide for that 24/7 care. Our goal in entering the LIFE program was that we would, at the congregation, would save some financial resources. And we haven't seen a lot of cost savings on that. Right now, they staff one unit. We have 3 units on our first floor, and they staff one from 7 to 3. And then the congregation continues to be responsible for the remaining other 2 shifts. So it's kind of been a challenge, and we hopefully will continue. Stuart and Sister Jean have also worked on this with us to try and move that forward.
Yeah, and in Pennsylvania, it's called LIFE instead of PACE because there's an all-inclusive. PACE is a medicine program in Pennsylvania.
But in the Philadelphia area, the 2 main providers, I said New Portland previously.
Let me get step this microphone. I said New Portland previously, they just sold, and I think this is an indication, they sold to Innovage,
Which is a big, probably for-profit.
You know them, he's smiling, the smile on his face is not a happy thing.
It's not a happy smile.
This is a very specialized business. What David does is something that takes great expertise and also
patience
from your board and so forth. Because you're at total risk, and so the financial remuneration, and from state to state it differs. If you're in states that have more robust Medicaid
programs,
the programs are resource better.
Yeah.
And that's important to note. And
what they're able to offer is based on that. But the providers themselves, the expertise in this area, Penn ran a program. What'd they find out? They could not run it. So now Mercy runs it. So Mercy Life can be a dynamic partner. We know the Sisters of St. Francis, those of you know, at Assisi House, have outsourced 2 of their shifts of care to Mercy. That was a struggle. It took a couple of years to get it done. That's a very fruitful relationship. But
As Sister Mary Kay said,
it depends on the provider, depends on the state you're in, and again, that provider's willingness to be creative and think outside the box and do as David has done, whether it's de-lice a house or whatever it happens to be. There's a lot of variability, but in Philadelphia, I know you're in good hands with Mercy Life. Dan Drake, those of you that know that name, will work with you. And that's for sisters that have skilled nursing needs. And then community health choices are for the others. We'll talk about that later. But just for your options in this area. And the other thing that was mentioned by David is that they will not force sisters to come to the center. So some sisters do not, they want to stay at the mother house or whatever. They can work innovatively with you. You can come there for your clinic appointments, but you don't have to participate necessarily in the daycare. So again, it's a good option.
Yeah, other questions?
Oh, sorry.
Yes.
Just updating David Stewart, Mercy Life, we, as the Sisters of Mercy, we just entered into a relationship with Mercy Life as of October 1st of this year. So, you know, we can't comment really yet because we're, 26 days into it. But all of that preliminary conversation until the county got, you know, until Mercy Life got the county approval certainly preceded that, but, you know, Mercy had been thinking about it for a long time, so we just started that journey, you know, a couple of weeks ago.
Yeah,
Yeah, Mercy just came to Norristown, or just came to Montgomery County. It's in Bucks and Philadelphia.
yeah, and I there's something I want to be a little careful of. I said, oh, we don't worry about money. I do. We have really good utilization management. So our doctors understand that we can take care of a person without putting them in the ER or in the hospital. And when when you can do that, when you have really good utilization management, that's where you really save the money. I want to save money on the Medicare side because where I really want to spend it is on the Medicaid side. Medicare money is to me about quality of care and, which we can manage well. What people truly care about is the Medicaid side, the quality of life piece, and that's where we're really impacting your day-to-day existence outside of the medicine side of it. So I don't want to be too blasé about, oh, don't worry about the money. The money is important, you have to make it work financially, but it is a viable financial program if you manage it correctly. The other thing is we're supposed to keep people out of nursing homes. Nursing homes are expensive, nobody wants to be there. So we, out of 1,500 people, we're usually run about 6% of our population in nursing homes, and those are people who really, really are no longer able to live in the community. But compare that to the population you would see at 80 plus, and it's pretty dramatic.
So if people have general questions for David, not program specific, I think that would be helpful.
Great. Yes.
Your slides earlier said that the money comes from Medicare, Medicaid, and private pay, but you didn't comment on the private pay part.
Because I don't know that we have a single person who's private pay, and let me explain why. Ours is an expensive program to deliver. So between Medicare and Medicaid, if you're only Medicare eligible, the copay on the Medicaid side is pretty substantial. So we rarely have anybody who's private pay. Now what we do have is we have spend down. We have people who have some assets and they're going to spend them down and then go on Medicaid. But that's why, yeah. Other questions?
They're mostly Medicaid eligible then.
Yeah, yes, and we do have one thing in California which may be different than here. We have a number of people who are only Medicaid eligible, so they have they're getting sort of a Medicare-like part of their Medicaid. In other words, it covers physician, hospital, things like that. Those are a little more challenging because the reimbursement there is a little skinny. Other questions? I just say thanks. This has been a nice opportunity to meet you all, and I enjoyed it, so I appreciate it. So.